Hi, my name is Sheila Hoff, and I'm a nurse that works at UCSD, University of San Diego Moores Cancer Center. And right now I'm working with a physician who specializes in treating leukemia patients. So today we're going to talk a little bit about how leukemia is diagnosed, the different types of leukemia, some of the signs or symptoms you might have if you have leukemia, and then the treatments that are available for leukemia. So leukemia is a cancer of the white blood cells. And your white blood cells are cells that circulate in your blood system. And your blood normally looks red because you also have red blood cells. But in there is also white blood cells. And each year, new therapies and treatments are being discovered to help treat leukemia. There are new ways that are being developed to manage some of the side effects of those therapies. And because of all these developments, the survival rates of leukemia have gone up over the years. So more people are living after the diagnosis of leukemia. So what is cancer? So leukemia is a cancer of white blood cells. And cancers develop when cells in your body become abnormal. They look like the original cells. So in other words, a breast cancer cell is similar to a normal breast cell, but it's become abnormal. It doesn't divide the same way that a normal breast tissue divides. And that's what makes it a cancer. That's what the definition of a cancer is when cells become abnormal for some reason. And we wish we knew that answer, why it is that cells become cancerous. But for some reason they do. And so leukemia is a cancer of your white blood cells. The way that we decide or the diagnosis of cancer is made is by looking at these cells under a microscope. And so tissue or cells from a person's body, if they think they might have cancer, tissue or cells are taken out of that person's body with a needle, or a little piece of it is cut off, and it's put on a slide, a glass, and it's looked at under a microscope. And there are special doctors called pathologists. And their training is to look at these cells under the microscope. And they help interpret, or they tell your doctor, your treating doctor, the person you're seeing, whether they think that you have cancer or not, based on looking at your cells under the microscope. So how do we get, when a patient or a person, we think that they might have leukemia, how do we get those cells? Well, your white blood cells and all the cells in your blood are actually made in your bone marrow. And your bone marrow is an area inside a cavity in your bone in the very center. And it's like if you've ever had chicken and you've broken a bone open, and there's like a little bit of red on the inside. It almost looks like blood. That is actually bone marrow. It lives inside your bones. And so to make the diagnosis, or to be able to tell you if you have leukemia, a doctor needs to do a procedure called a bone marrow biopsy. And what they do is they have you come in and you lay on a table on your stomach. You lay down on your stomach, and the doctor will numb the area of your skin over your hip bone, over your pelvis or hip bone. And they put a needle in to the center of your bone and pull out the bone marrow. And then that bone marrow is sent to the pathologist to see whether you might have leukemia. Now, the diagnosis of leukemia can be made by either getting bone marrow. The other way that we can kind of tell whether you might have leukemia, another test, is to do a complete blood count. And that is by getting a tube of blood from your arm, and it's sent to the lab, and in the laboratory they're able to tell what different types of cells are in your blood. And what happens is your bone marrow cavity inside your bones is like a box. And what happens when you have leukemia is that box begins to fill up with leukemia cells, the bad cancer cells. And as the box becomes more and more filled with the cancer cells, there's less space for your own normal, healthy bone marrow to grow. So there's less and less space there. And so your bone marrow your healthy bone marrow begins to try and work very hard to make more and more normal, healthy cells for your body. And because of that, and because it has so little space, actually some of the immature, the baby cells, come out of your bone marrow and are in your circulating blood system. And those baby cells are called blasts. And those blasts, if they're in your blood that we take out of your arm, that's abnormal. It's very abnormal. And it's another sign to the doctors that you might have leukemia. So just a little bit about the differences. Leukemias are, there's two different types of leukemia. There is a chronic leukemia, and that's a very slow-growing cancer. From the time you first find out that you have that type of leukemia until you need treatment is usually months to years of time. There are actually people who don't ever need treatment for the leukemia. It usually occurs in people who are older adults. The average age of people diagnosed with chronic leukemia is 65. So they're older people, and because it's so slow growing, oftentimes they actually end up dying of another cause other than their leukemia. The other kind of leukemia is an acute leukemia. And acute leukemia, by the sound of it, is actually a faster growing leukemia. When people are diagnosed with an acute leukemia, the treatment is immediate. Usually people have to be hospitalized. They have to go into the hospital, and the treatment begins immediately. This type of leukemia usually occurs either in young adults or children. It's one of the more common childhood cancers is acute leukemia. The good news is, though, even though it's a fast-growing type of leukemia, acute leukemia is a curable type of cancer. Now we're going to talk a little bit about some of the signs that someone might experience if they have leukemia. One of the first ones is fatigue. And I know we all experience fatigue normally in our daily lives, but this is even more so. You are tired most of the time, frequent naps, you're not able to do the things that you normally were able to do maybe a couple of months ago. Another sign that can happen, a symptom, is infections. Infections can happen like more colds, skin infections that don't heal. So if you get a cut on your hand and it doesn't heal normally, that's sometimes what people say when they're diagnosed with leukemias. And then the other sign that people sometimes have is bruising or bleeding. So the bruising can usually be in your arms or legs because you accidentally hit them against something, but it happens more frequently than it would normally for you. So you have lots of bruises versus just one, maybe once a week or something. The other thing is bleeding. You may notice bleeding in your gums, near your teeth, or after you've gone to the bathroom and wiped on the toilet paper. Sometimes there might be blood there. Now, the problem with most of these symptoms is that they're common to a lot of other diseases or illnesses that people may have. So sometimes when a person comes into their doctor and they have these symptoms, actually most of the time, it's not leukemia. So we don't want to scare you and have you think that if you're tired and have bruising that you have leukemia. That's usually not the case. Leukemia is a rare thing that happens. These are just some of the things that people report when they're diagnosed. So again, we talked about a complete blood count. That's one of the first tests that your doctor will do if he suspects or thinks you might have leukemia. And the things that you would have are an abnormality in your white blood count, and your white blood count would be very, very high because there are so many leukemia cells in your blood system, and it makes your white count become very high. But that doesn't mean they're normal healthy cells. You actually have a lot of leukemia and very little healthy cells. And that's why people have infections, because there are not very many of those healthy cells to help fight infection in your body. And your red cells may be low. Your red blood cells are the ones that carry oxygen to all the cells in your body. And so when they're low, you can have fatigue. And that's why people are tired sometimes when they have leukemia. And then the last thing one of the last things that the doctor will look at in your blood test are platelets. Platelets are components in your blood, or things in your blood, they're proteins that cause clots to form, or a scab. So when you cut yourself, you form a scab when it stops bleeding. There's like a red crusty area that's called a scab, and that is formed by platelets. So if you don't have very many healthy platelets, then when you get cut, you will continue to bleed. You won't be able to form a scab because your platelets are low. and your platelets would be low, or your red cells would be low, because you have so many leukemia cells in your bone marrow. There's not enough healthy bone marrow to make those normal parts of your blood. Okay. The next thing we're going to talk about is, so now that it's very stressful if the doctor tells you that you have leukemia, so what's next? It would be the treatment of the leukemia. And again, you have to think about it as when we talk about it, we talk about the chronic leukemia and the acute leukemia. So we're going to talk a little bit about each of those therapies in those instances. With chronic leukemia, the medicines can be pills, or they can be infusions, or medicines that are liquids that are infused or given to you through an IV, a catheter in your arm. A lot of times you see that on TV, where people have a bag of fluid and there's a catheter that goes into their arm that's giving them those medicines. So with chronic leukemia, the medicines are almost always given as an outpatient, meaning you go into the clinic, you get the therapy, and then you go home that same day. And the side effects are, there aren't as many side effects with those types of therapies. And then if there's pills that you're given, then the doctor would give you pills or medicines to take. You'd fill it at your pharmacy and bring it home, and you'd then take the pills and then come back and see the doctor after a number of weeks, and they would be able to tell you how well the medicines have been working for you. So that's chronic leukemia. Everything's done as an outpatient. You stay at home, and everything's dispensed in the clinic. When you have acute leukemia, unfortunately, because the treatment, because the cancer cells are growing so rapidly, the therapy is much stronger. And so people have to be admitted to the hospital for these therapies. And they have to stay for a number of days and then sometimes weeks after to recover from the therapy. The therapy for acute leukemia is usually given as IVs. Not very many pills are given for acute leukemia. And people have a lot of side effects from these medicines. They can become nauseous, sick to their stomach. They usually lose all of their hair, and they really don't feel very well. They feel very sick, tired. So with acute leukemia, the therapies are very strong and intense. But again, we have to remember then that there's also the potential with acute leukemias for the cancer to be cured, for it to go away completely. With chronic leukemias, our goal is a remission, or where we can't find the cancer for a while. We get it down to a very low point, and it's like sleeping, and it sleeps for a number of months to years before it may come back, and people need more therapy then. So that's with chronic leukemia. We hope to get it into a remission. So many of the treatments that we give for leukemia are done as part of research or clinical trials. And the reason that is because we don't know for sure what the best treatment is for the leukemias. And because we don't know those answers, doctors are always looking for better ways to treat cancers. And so they do studies or clinical trials to try and find better therapies. And with leukemia, many of the treatments that are offered by doctors are done as part of a clinical trial. So the last thing I want to just touch on is if someone you know might have leukemia, what kind of things might you expect if your friend or family member has leukemia? You probably have realized that it depends on whether they have chronic leukemia or acute leukemia. With chronic leukemia, you probably won't notice any difference. Many patients don't even tell their family and friends that they have leukemia when they have chronic leukemia because they don't feel very different, they don't look any different. Many times they're taking pills or they have to come in to to see the doctor maybe once a month, and so it doesn't really affect their life as much and they don't feel any different. So you many times don't know when someone has chronic leukemias. With acute leukemia, again, the therapies are so much stronger. They have to be because the cancer is growing so fast that you will notice many times that people, again, if they're hospitalized, they won't be into work, they won't be able to work for a number of days to weeks. They lose their hair, so they look different. If they're nauseous or sick to their stomach, sometimes they lose weight, so they look thinner. But one of the things in working with people who have cancer, I think that they often they feel isolated. They're afraid and they feel alone because people are afraid to communicate with them, to approach them. So I think that one of the most helpful things we can do when someone has a leukemia or any cancer is to stay in touch with them, to visit them, maybe drop them a note just saying you're thinking about them. It doesn't have to be long or be anything poetic or brilliant. It just needs to let them know that you're thinking about them and to know that you care. Someone at work may have leukemia and you don't see them for a while. You may just drop them a note or let them know that you're thinking about them. Anyway, so today I just wanted to share a little bit with you about leukemia to let you know that parts of it are very frightening, and but that we continue to learn more and more about ways to treat the leukemia, and through research we found many different ways that can make the leukemia treatments easier to tolerate also. So I want to thank you for listening and for learning a little bit more, hopefully, about leukemia. Thank you.